Hi, hope you're fine. I'm also in good condition. Today we will discuss relating to selection of toothbrushes, selection of toothpaste, which are essential tools and devices and materials for oral health. Normally in markets there are three varieties of toothbrushes available: soft, medium and hard. Hard toothbrush. The filaments or bristles of the toothbrush are in hard consistency, which can injure the soft tissue of gums and can abrade the tooth structure. So this toothbrush is not good for the dental health. Second is medium. Medium also can abrade the tooth structure and injure the gingiva. For common use, ideal toothbrush must be soft. We can check it with finger. The consistency of the toothbrush, mostly the company mentioned on the handle of the toothbrush whether is soft or hard. So ideally brush filaments must be soft so that it is friendly to the gums and avoid the recession of the gum tissue. Handle of the brush must be flat and brushing technique must be vertical from upside down. Never brush in horizontal direction. Always brush vertically in one direction away from the gum tissues. Second important thing which helps in teeth cleaning as an adjunct or auxiliary to the toothbrush is toothpaste. The main function of toothbrush is mechanical removal of dental plaque, which is basically a soft layer of bacteria covering the outer surface of the tooth structure. Brush can easily remove this sticky and adherent layer from the tooth surface. Plus, toothpaste help in removing this layer and also multiple functions toothpaste have, like when our teeth are sensitive, we need special ingredients in the toothpaste like fluoride, strontium chloride, potassium nitrate, which can block or desensitize the nerve inside the dentinal tubules so that sensitivity or sensation of hot and cold will be blocked or removed. So these desensitizer are very important for sensitive teeth treatment. Second common problem is bleeding gums. For bleeding gums, we require a special paste which contain tranexamic acid, or some paste contain clove oil which help in reducing the swelling and pain of the gum tissue. Third problem is cleaning of the teeth. Mostly toothpaste contain baking soda which helps in removing the dental plaque from the teeth surfaces. And other important thing is calculus or tartar removal, which is the hardest layer over the tooth structure. Some toothpaste contain zinc, which aid in or help in removal or prevention of formation of the tartar or calculus. So whenever you go to market for purchasing of toothpaste, always read the ingredients mentioned over the toothpaste. Another important thing is teeth whitening toothpaste. Usually these toothpaste contain higher quantity of abrasives which can abrade our teeth. So always select those toothpaste which contain very little amount of abrasives as the more the abrasives, the more the grinding of our teeth, and ultimate our teeth become sensitive after use of these toothpaste. And another important thing is amount of fluoride in the toothpaste. Usually fluoride help in reducing sensitivity and preventing tooth decay or cavities from the teeth structure, but excess amount of fluoride is toxic to our body. If we swallow the toothpaste containing fluoride with excess amount, our bones become brittle, and especially in children, there is more chance of toxicity with fluoride. In children, we can use fluoride-free toothpaste or toothpaste containing xylitol, which is an essential ingredient in preventing the dental caries or tooth decay. So, these two things are very important: toothbrush and toothpaste. Selection of toothbrush: always select a soft filamented toothbrush, and for toothpaste, it depends on your problem. Either you have sensitive teeth, bleeding gums, bad breath from the mouth. The paste containing mint can mask the effect of bad breath and teeth whitening problems. So always select according to your problem. But usually the normal toothpaste which we regularly use contain fluoride, and for some polishing agents, lightly abrasives for cleaning of the tooth structure. The main thing is always brush before going to bed and before the breakfast. Make your habit to strictly follow these guidelines, and always rinse after eating food or any sweet thing, especially chocolates or other sticky items which can stick to your teeth and can start the process of tooth decay. Hopefully, this video will be helpful to you. If any question related to this video, you can ask in the comment box, and like and subscribe the channel so that further information will be delivered to you. Thank you.